and the procedural things you should look at with the test are outlined on page 30 and 31. So Joe, come on up here. We're going to go through and show you the, I'm sorry, Jonathan, I call you Joe. Jonathan, come on up here. We're going to go through 4 tests, okay? We're going to go through the adduction drop test, which is on page 29 in your manual, and Jen's going to help us out with that. We're going to look at extension drop test. These 2 particular tests are also covered in a course called Myokinematic. Posture Restoration Institute puts on this Myokinematic course. And then we're going to look at trunk rotation and apical expansion. Heidi, would you do me a favor and just walk over there in the vision? Heidi, would you do me a favor and grab me a yardstick? Do you mind? I don't think we got one out here. So why are these 4 tests picked? These 4 tests are picked to tell you whether or not you have hypertonicity, hyperactivity of a polyarticular chain on one or both sides of your body. That's why they're there. They're objective. They're objective tests. They tell us whether or not, do you see that little asterisk by the first one and the third one and the fourth one? They're going to tell us whether or not your patient can actually correlate their breathing with the ability to work their frontal plane and their transverse plane. Trunk rotation, transverse plane. Adduction, frontal plane. And apical expansion is going to be a reflection of those 2 planes. If apical expansion is limited, then you're probably going to see limitations in those 2 planes. That's the message. I'm going to show you when somebody's neutral or not neutral. The reason the extension drop test is in there is because, as physical therapists anyway, people like to look at hip flexors. And the first thing we like to do, if an extension drop test is positive, which means you cannot do it, we like to stretch. And before we stretch anything else out, let's see if we really need to. So there are 4 good tests that I like to look at for determining whether or not you have a person who has a zone of apposition. All right. As we go through that, please ask questions if you have them. First one's called the adduction drop test. I'm going to show you the test. Jen, if you don't mind on this test, could you tell everybody while I get them up here what the test indications are? So everybody understands positive test means something is not going the way it's supposed to be going. Okay? A negative test means there's no results that we can get anything from. In other words, it means either you have a joint that's doing something that it should not be doing, or you have a joint that's in the right position. It's a negative test. So on the adduction drop test, Jen, what does the test results mean?
A positive test is indicated by a restriction from the anterior inferior acetabular labral rim, transverse ligament, and piriformis muscle, or impact of the posterior inferior femoral neck on posterior inferior rim of the acetabulum that does not allow the femur to adduct, possibly secondary to an anteriorly rotated forward hemipelvis. This is usually seen on the left, especially if the left extension drop test is positive in a left AIC-oriented patient.
So a left AIC-oriented patient is going to be somebody who likes to stand on their right side, who likes to produce torque and tension on the right side, and needs a neural stability. They have a rib cage, thank you, they have a rib cage that is more than likely advanced upwardly on the left side, and the ribs are in a state of external rotation. They have a rib cage that is internally oriented on the right side, and their torso then is over to the upper ribs are going to the left, while their center of gravity is shifted to the right. That's 1/2 the gait cycle. And if you look at the pelvis, you would see something like this, or something like this. And then when I take his leg back and I try to adduct it, he can't adduct, as the illustration will show you, because the medial rim of that acetabulum is prematurely hitting his neck of the femur, which will not allow him to what? Adduct. That's a positive test. Okay, if he doesn't have a positive test, I'll create one for you with a balloon. Okay, does that make sense? I'm going to, no matter what I got here, I'm going to create something if he doesn't demonstrate it. So I'm going to take his left leg, I'll bring it up. In other words, I can create things with the balloon and I can take things away with the balloon. Not because it's elastic, but because you got to learn how to control your tongue with the balloon. So this is a positive test. I knew it when he was sat down this morning. So did Jen. We've been talking about you.
Thanks.
You've been hanging around Mike way too much. That's a positive test, okay? Now we're going to flip around. We'll put his head down here on the other end. We'll just flip him. We'll put his head over here. And I lined his femur up with his torso. I'm looking at his torso. I need a little flexion. And I'm going to keep him in a state where he's not extending. Because if I extend his back, I'm going to get a false positive test. So on this side, if I take his leg back and I secure his innominate, and I keep going back, he hasn't extended his back, that's a negative test. My hand did not move. Would you agree, Jonathan? Feels a little looser on this side.
Yeah.
Flip back over. This is not the right way to do this test. And this is what a lot of people do. And this is in the Mao King course, but I'm going to show it to you real quick. This is not the thing you want to do. I'm sorry. Did you hear that crack? I won't charge you a thing for that. But over here, I'm in this position. I extended his back way too much. Now, I'm manhandling this guy. And you know in that position, he's definitely not going to go down. Everybody with me? I should have stopped. Right, Jonathan? You're going to keep me honest.
Yep.
Right there. Because if I go any further, he's going into lordosis. Let's see if the extension drop test tells me that's a fact. Okay? We're doing okay with the adduction drop test. At this point, I have reason to feel pretty secure that he's a normal human being and did not come from Mars. This is probably pretty normal. Okay? Now he's going to sit up over the edge of the bed, and Jen's going to tell you what a positive test is. Let's come on over here, okay? Let's come on.
A positive test is indicated when the tested lower extremity, usually the left, is restricted in hip extension because of the forward orientation of the tested side compared to the other. If both femurs do not approach the edge of the mat or table the patient is tested on, the anonymous are rotated forward bilaterally and the psoas muscles are on slack. Placing the femur in neutral is actually placing the patient's femur in external rotation. This lengthens the TFL and VL, which could lead to hyperactivity, restricting hip extension.
And we already know the test should be positive on the left side because, Heather, he prematurely stopped me from full extension, 30 degrees, the last 30 degrees of extending in that position he was in. He stopped me. If I kept going, I would have had to lordotically increase the activity of his back. So he should be, go ahead and lay on your back, Jonathan. Scoot down here towards me a little bit. He should be able to, I'm going to take his sacrum, find where his sacrum is going to lay on that surface of that mat comfortably. That is not it, Jonathan. Jonathan, that is it. Jonathan, that is not it. Do you feel that? The lumbar spine's in the air there. The sacrum is flat there. Your tailbone's off the mat there. This is where you would be for this test. And you may want to play with that. I don't like either one of these tests, but I want to show them to you. Okay? He's going to lower this leg down. He's going to lower this leg down and lower this leg down, and then I'm going to have you bend your knee a little bit. Just bend your knee. And that's a positive test because he cannot bring this femur all the way down to the mat. So he's limited in extension. Oh, wait, Ron. He's not limited in extension. He appears to be limited in extension. But the start position of the test on this individual is not correct. His pelvis is too far what? Anteriorly rotated. So how do I know, Rick, if he's limited in extension? Now you understand why I don't like this test. Do you guys understand? How do you know if he's in a neutral position? How do you know? That's why we're going to do all four. On the other side, if I take his leg and I put him in a neutral state, and I lower this leg, Jonathan, does that feel like it's going to go down a lot easier?
Yeah.
So how do I know if he really doesn't have an overstretched hip on this side? Well, I already have two tests that tell me that this leg is probably in a better position than this leg. He can adduct on the right side, and he can extend his leg on the right side. He can't adduct his leg on the left side, and he cannot extend his leg on the left side. Oh, but he can extend his leg on the left side. I didn't show you the whole picture. If I take his leg on the left side and I internally orientate that femur, like I am doing right now, oh, isn't that amazing? He has full extension. Because if I internally rotate his femur to match and line up with the acetabulum that's inwardly oriented on the left side, he has full extension. So now I got to tell myself, well, he can't walk around with a horse that's always going in one direction, that would be to the right, because he's internally rotated on the left. I probably ought to do something to get his sacrum and his innominate back over to the left, which means I probably ought to do something with his rib cage and get it to turn to the right. Because if he can't rotate his rib cage to the right, he'll never get his pelvis to the left, and he'll never extend and adduct, with a lot of pathology going on called torque. His knee could hurt. His hip could hurt. But this is a different course. He's twisted. His diaphragm is twisted. He's blocked. Respiratorily, he can't get air in. He's torqued. Does that make sense, everybody? Well, let's check that out. We have another test, and it's called trunk rotation test. Let's go back. You don't have to read the position in, but what does a positive test mean, Jen?
A positive test is indicated when the legs do not rotate in one direction as compared to the other. For example, the legs are restricted in rotation to the left. Example, the legs do not rotate to the left as far as they do to the right, as measured through the use of an upright ruler. This means that trunk rotation is limited more to the right, secondary to probable left hip anterior rotation and sacral-lumbar orientation of the spine to the right. Therefore, postural restoration should be initiated at the left lower extremity to address left mechanical instability and maintain proper restored pelvic femoral neuromechanics.
And the word is neuromechanics. He's got to figure out how to do that. And in so many words, if I put my hand on his rib cage and I secure your rib cage, Jonathan, and I say, go ahead and breathe. Just try not to hold your breath, okay? And if he was already holding his breath, you already know, Tessa, he's going to be limited in both directions. And if he's limited in both directions and his scores are the same, I really don't get anything from this test, except I'll write down the number that I have and see if that information that he gave me is going to improve on the next procedure I'm going to do to treat him. But right now, we look like we got a fish that's kind of stinky. We've got a left side that's a little bit too anteriorly positioned, forwardly positioned, and rotate in a position to maximize his stability with his diaphragm on the right side for postural support. It looks to me like his left diaphragm is really not in a position to give him quality ventilatory activity through the right brachial chain. His lungs are too restricted. His lungs can't alveolar exchange. Look at all I'm getting from two tests. Now I'm going to verify it with this test, because if this test tells me he can't rotate his trunk to the right, I'm now going to classify him as a what? Left AIC, right BC patient. Now the first test just tells me he has his pelvis forward. But if he can't turn his trunk, I know he's got some brachial chain issues. And then we're going to stick in one more big one, the big kahuna. We're going to see whether or not he can really get airflow on the right side like he can the what. And then we got it all. And then we're going to compare all those correlations to see if they all changed once we get his airflow to improve on which side? The right side. And if all those things change, what structure is affecting his appendicular activity? His diaphragm. And so before you do anything with his feet, his hip, or anything else, you probably ought to go and say to yourself, Tessa, let's make sure his diaphragm has the ability to serve him for purposes of ventilation and rib rotation versus serving him for postural stability because he can't shift his diaphragm and his ribs over to which side? The left. So here's trunk rotation to the right.